This is our first session for Peer Effects, and I'm speaking to Dr. Clement Kwok at the Internal Medicine and Infection Disease Center. You're a clinical instructor and chair of Infection Control Committee on Westminster Highway in Richmond, BC. And we're going to be chatting about the coronavirus and any thoughts that you can bring to help dentists tackle what we're facing now. And welcome to the first session. You're my first interviewee.
Sure. So as of this afternoon,
yes.
Canada are impacted by the coronavirus in a major way. There are 1,558 confirmed cases, and in BC, there's 472 with 13 deaths. So the coronavirus is affecting us in a major way.
Yes.
Most of the hospitals are affected, and they're working on minimizing non-essential service so that we can provide additional capacity in case the COVID patients become a major issue to our system. Obviously, there are multiple messages from public health, from the Ministry of Health, and different social media. And sometimes these messages are complementary, but sometimes they are contradictory. So hopefully I can provide some clarification or some guidance from my experience to help the dentist group.
Yes, yeah, no, that's fantastic. So right now, the status in the hospitals in the Lower Mainland is not terrible, but I guess the point is we want to do as much as we can to keep people from the hospitals as much as possible. So as dentists, we're hoping to treat the dental emergencies as much as possible, and that's why we'd like to chat to you. Is there basically anything specific that would help your medical colleagues, the dentists, could do at this time?
Well, the most important thing is try to stay well yourself. Try to minimize contact with patients that you think may be exposed or suspected or even confirmed to have the COVID-19 infections. And if possible, try to reschedule or even cancel some of the non-urgent or elective or cosmetic procedures until these patients recover from their respiratory tract infections or after they complete their supposed 14-day self-isolation. That will bring the risk down to minimal if possible. And I think the other thing is those of you who have underlying medical conditions, such as cardiac diseases or taking immunosuppressive medications, those would be very critical to avoid exposure to the COVID-19 patients, because from the data, we know that people who have these underlying conditions do not do well if they become infected or exposed to the COVID-19.
Mm-hmm. Mm-hmm. Yes, and well, as it stands right now, dentists are restricting their treatment to urgent and emergency patients only,
Mm-hmm.
and all non-urgent treatment has been canceled. Most dental offices in the province are closed.
Mm-hmm.
We're restricting our treatment to urgent care. And anyone, and correct me if I'm wrong, but our premise is if anyone is showing signs of COVID, we don't treat them because we don't have the facilities to treat someone who is coughing and splurting in our office. But we assume that every patient, as of today, going forward, has it, and we use the precautions. Does that ring true with you? Do you think that's a good approach?
Yeah, I think that's very reasonable, and I think with some of the hospitals in Lower Mainland, we actually try to organize designated teams to look after patients who are suspected or even confirmed cases. So I think a similar concept may be applicable to the dentist group, whether or not for example, one individual dentist can be assigned for certain weeks of the month to be designated to look after emergency patients who can potentially have the infection, and then rotate through the schedule if possible, so that the number of dentists exposed to possible COVID-19 can be minimized. Yeah, so that would be one approach. The other approach would be, the usual precautions, right? Make sure, all the precautions with wearing masks, gloves, or even double gloving if that does not impair with your dental work or the dexterity, and safety goggles, hair nets, or even disposable gowns could sometimes be used to reduce the chance, depending on how extensive and how much aerosolizing procedures you're undertaking with that particular patient. And the other thing would be some tricks in terms of working around booking and scheduling, right? Have the patient, for example, wearing a surgical mask in the waiting area, for example, before you actually get started. I think that helps to protect both your clinic staff and yourself, and also, try to protect the other patients, for example, waiting in the same area, if that happens to be the case. Yeah.
Yeah, what I was chatting with some dentists earlier, and what we're proposing to do is actually to remove the chairs from our waiting rooms.
Mm-hmm.
Say the patients wait outside or in your car, and we'll call you to come into the office when it's ready. So we basically have one patient come in, and we treat them as emergency basis in the office. Then that patient leaves, and the staff have a chance to clean the operatory and the office, and then we could call the next patient to come in. And so we don't have people waiting in our waiting room, breathing the air and touching things. It's like, no, stay outside, and then just come in for your appointment, and then come back out, and then the staff can clean the room, and then the next person comes in, and then that person is coming into a clean room, as opposed to being in an office that potentially one half, maybe the virus's aerosols are there. Why even be in the room? I'm sorry,
Yeah.
in the office. Does that seem reasonable? Is that getting a little too much?
I think that's a very smart idea. And in fact, speaking with some of my colleagues, that's that's one of the approaches that they're pursuing. Of course, depending on where your office is, if you're, let's say, in the 13th floor of a tall building, then you do want to make sure in the process of getting to your office, then they do not contaminate other common areas.
Right. Okay. And the surgical gowns for dental treatment, would you say are not absolutely necessary? It's ideal to have it. Some people are talking about putting garbage bags, cutting a hole and putting garbage bags over them, and then for each patient just throwing out that garbage bag. Is that excessive? Is it reasonable?
Well, if you have, disposable or surgical gowns available, that would be optimal.
Yeah.
And if not, then, whether or not the next go-to would be whether or not you have surgical scrubs to sort of change in between. That would be the next best. I think, it's not so much about, the material itself. I think it's the frequency of changing that outfit, so that you, number one, do not cross-contaminate between patients, and you don't contaminate yourself. I mean, using garbage bags, probably will work. It's not, it doesn't look very nice, but if that's, what it comes down to in terms of running out of options, that's something to be considered. Yeah.
Or change your lab coats or a change of clothes. But I guess the take-home message is change, whatever it is.
Exactly. Changing between patients or change, as you see fit. For example, if you, after working on a patient and then you want to have lunch, for example, then obviously change whatever you are wearing, Yeah.
Okay. Is there any red flag for you as a patient that at this point in time, we would, right off the bat, you would say, don't come in the dental office. You need to go, for medical attention, just something, or any red flags at all?
Well, if they are having respiratory distress, right? For example, if they're out of breath, if they are having very high temperature, I'm talking about more than 39 degrees,
Okay.
or if they're showing any signs of cardiopulmonary compromise, symptoms of shock, or even having cyanosis, looking blue in their mucosal surface, those patients should just go directly to the emergency room, and they're not medically fit for any type of dental work.
Okay, so over 39, that's a bit of a red line.
Mm-hmm.
If they're over 38, perhaps come back another day.
Well, I mean, so I use the temperature of 39 because usually with a very high fever, there's a more a chance of having severe sepsis. Yeah,
Okay.
the low-grade temperature does not necessarily mean they are not infectious, but that just means they are more likely to be medically stable. But from an infection control point of view, they can still spread the coronavirus. So if the proposed dental procedure is not in urgent situation, then I would prefer those patients to have their symptoms completely resolved before they're brought into the dental office.
Yeah. And people can remain asymptomatic and carriers and sloughing off the virus. I'm hearing times of up to 6 days. Does that ring true with you?
So there's actually a study looking at an outbreak in the cruise ship. Okay, so basically they screened everyone on the cruise ship, and there were about 600 individuals were screened, and they found a significant number of them are actually asymptomatic but are positive. Okay, so whether or not these asymptomatic individuals and to how much of an extent they can spread the virus is still unknown, but asymptomatic carriers do exist. Okay, and if you work on them with aerosolizing procedures, there's a perceivable chance that these patients may spread the virus. Okay, so if you have a suspicion of these patients who have possible exposures to a confirmed case, and I would recommend them to be self-isolating until it is clear that they do not become symptomatic from a respiratory point of view before proceeding to any dental procedures.
Okay. Yeah, so any signs and symptoms, self-isolate 2 weeks?
Yeah, 14 days would be the recommendation. And even if they're asymptomatic, but if they're exposed or household contacts of a confirmed case, then they should also be doing self-isolation, and definitely 14 days before they should proceed with any dental procedures if they're not imminently needing the proposed dental work. Yeah.
Okay, and we should assume everyone is a carrier and then have the same precautions for everyone, because we're not sure at this point asymptomatic people are sloughing it off or not, so we might as well at this point assume that they are and do the same precautions for everybody. Does that
of course, yeah. I think the message is assume that they are infected until proven otherwise, right? So I mean, especially in high risk profession like dentists, you guys are manipulating the upper airway, which has the highest density of the coronavirus. So I do think it should be hypervigilant with all the precautions that you should be taking.
Okay. I was thinking saying to patients, giving the patients instructions prior to them seeing dentists. I will run these precautions by you and let me know your thoughts on them. One of them I would say is the night before your dental appointment, wash your sheets so they're clean. You don't want to have sheets from the day before. And then when you come into the dental appointment, come straight from your house to the dental office and should have cleanly laundered clothes only. Rinse your mouth with either vinegar, salt, salt or lemon, at home before you leave. And then when you come into the office, we do our bit. But then when they leave the dental office, they should go straight home, and then when they get to the home, go straight to the bathroom and either have a shower or bath, and then wash their clothes.
Well, I mean, the rinsing the mouth with vinegar, for example, I don't think right now we have definitive evidence to say that it helps or not. Yeah. I mean, there's no evidence of harm, but I don't know if it will be helpful or not. Yeah. And the most important part still is hand hygiene. So, I would recommend, doing hand hygiene, throughout the different steps that you laid out. For example, before leaving the door, getting in and out of the car, upon arrival to the dental clinic, leaving the dental clinic, getting back onto the car, if they have alcohol sanitizers or sink to wash their hands, those needs to be performed very diligently, and ideally, every even 15 or 20 minutes, if possible, during that procedure. And also the other thing is try to minimize people who can be exposed. For example, do not bring 4 or 5 people together with you to the dental work. Just either go by yourself or whoever needs to bring you for a ride, and that person does not necessarily need to even come to the clinic. Those would be consistent with the idea of social distancing, right? So the two important keys are hand hygiene and social distancing. So, think about creative ways how to minimize, other people from being exposed, and also, take every opportunity to perform hand hygiene. Yeah, would be my recommendations. And in terms of, bed sheets and, and also, household equipment in general, we do know that, sometimes the virus can survive on surfaces for up to 2 to 3 days. So make sure not even just the bed sheets, right? For example, the dining table, your desk, your couch, if they can be clean, that would be important, not to cross contaminate the surfaces.
Now, when they clean those, soap and water, or do they have to do something more drastic? This is at home. Is soap and water sufficient, or do we need to use Lysol or stronger chemicals?
Well, at home, I think using just regular disinfectant should be adequate. But of course, in medical setting, in the dental office, the requirement is obviously more stringent, and with coronaviruses, usually I would recommend agents that contain quaternary ammonium or hydrogen peroxide.
Okay. All right. And the N95 mask is, as we were just chatting before, is the Cadillac, and the N95 surgical mask is a Cadillac Deluxe, but those are few and far between on the ground. So is that a line in the sand? No N95, no treatment, or what can we do? Because it's those are like gold dust right now to get our hands on them.
Right. So that number one goes back to the idea of having designated team or having one designated person to work on the suspected COVID-19 patients, right? So if you have an N95 mask used by one person, it's probably easier than having 3 dentists trying to use the mask.
Yeah. Hello? Oh yeah, sorry, I lost you there for a moment.
Sorry. There's a message here. So basically, it would be easier to have one designated person so that you can reduce the demand for the N95 mask. That's number one. And number two, does surgical mask have no protection for the aerosolized coronavirus? No, that's not true. It still protects you, but it will be to a lesser degree. So for surgical masks, for level 3 surgical masks, for example, they are designed to protect you from splash of bodily fluids. And they're not designed to protect you for aerosolized coronavirus. And aerosolized coronavirus, they behave pretty much like tuberculosis. They can behave as airborne pathogens if they're aerosolized. Okay, so you're still posing some risk to yourself if you are wearing the surgical mask to do work on these patients. The only way that I can think of is either you work on them with shorter duration, for example, and minimize the aerosolized procedures that you should be doing on them, and try to bring them back when their respiratory symptoms resolve, for example. So I don't know, obviously, all the intricate details of different dental procedures, right? But instead of, working on a major, dental implant, on that day, maybe trying to do, something less extensive, and then have them brought back at a later occasion when their respiratory symptoms resolve. And obviously, N95 masks are difficult to come by, but it's not impossible. And having that said, N95 mask is not 100% protection either. They have to be fit tested in order to be completely effective. So if you wear a non-fitted N95 mask, that does not necessarily mean you are more protected than wearing a surgical mask.
Okay. Now, I haven't read the brochure on the N95. If you're wearing an N95, that's one patient, one mask, generally?
Yes.
Yeah. So now, talking amongst ourselves, some dentists are saying, well, if I have an N95, if I put a surgical mask over it, can I replace the surgical mask and keep the N95 underneath it? Or is that just being silly? Wear that N95 one and then go for a surgical mask afterwards. So if you have like one high-risk patient, just use that N95 once, then move on and have the surgical mask, each person, in your day. Okay, in your dental day, you're seeing 4 patients, and your middle patient is the high-risk one, which is silly because we tend to have the high risk at the end. But let's just say that's the scenario. Does it make sense to wear that N95 mask and then have maybe a surgical mask over it, and then you're replacing the surgical mask? Or just, how would you approach that? Or what would be your recommendation?
Right. So, there are a number of scenarios, right? So if you have all 4 patients, for example, are all confirmed COVID-19, and technically then you may not actually need to change the N95 mask because they're all confirmed cases.
I see, yes.
So if some of them are suspected, not confirmed, and some of them are confirmed, then if you go from the unconfirmed ones first and then going to the confirmed cases, then the likelihood of passing the COVID-19 to the unconfirmed or of the non-COVID patients would be quite low because you're postponing them till the end. So those are obviously not recommended, but if you only have one N95 mask to use for all these patients, that would be the most logical approach to do it. In terms of wearing a surgical mask over N95 mask, so surgical mask protects you and also protects the patient, okay, from contracting, the usual bodily fluids. So, is there any testing in terms of, whether or not the surgical mask prevent the coronavirus aerosols from getting onto the N95 mask? So that there's no data, but it will be better than not having the surgical mask on top of the N95 mask, because it, even though the filters are with larger pores on the surgical mask, but it still can provide you with droplet precaution at the least. So I think if you are again down to just one N95 mask, that may be a desperate solution, that you might have to do.
Okay. Okay. Well, what would we were chatting about protecting ourselves and protecting the patients, and we'll change our clothes, each patient, or have surgical scrubs. The same applies for our staff,
Mm-hmm.
right? Is it?
Yes.
Yeah. And what steps are you taking? Because I imagine you're treating high risk patients. That you're taking that you think would be good for dentists and other practitioners to implement, so they protect themselves and their family.
So certainly, I think the most important thing is hand hygiene, right? So that needs to be done very diligently. And the other thing that I think many people might have not pay attention to is where and when you eat or drink. For example, having a cup of coffee in the same room that you perform aerosolizing procedures, that's not ideal. Okay, so what I would recommend is try to avoid eating or drinking even coffee or water in all clinical areas. So that should be easy to perform and very effective, because with eating and drinking, that's actually one of the high risk activities to acquire the coronavirus. Okay, so that's number one. And number two is try to come with many of my colleagues, we're trying to come up with a preemptive home isolation strategy. So for example, if you have worked with a confirmed COVID patient, then when you get home, then how do you logistically get from the door to your room? I think that needs to be thought out very carefully. Okay, and for example, where to put your dirty clothes and dirty shoes and your equipment that you might bring home, or your briefcase, for example, which area is the dirty area, which area should be the clean area, and which path you should take from the door, for example, to your bathroom for shower right after your work. So that needs to be clearly planned out, if you are to work with the confirmed patients. And some of my colleagues even go as far as, for example, having an area of the basement designated as the self-isolation area, in case there's any suspicion that you might have exposed unprotected to a patient, then that can be the area for you to stay, until you're clear that you're not infected with the virus. So that would be something to look into. I think for the dentist group as well, how you can do some of these practices when you get home, how not to spread to your family members. I think that's also been talked about quite widely in the medical profession.
Okay. Yeah, so I would assume that perhaps you would want to change at the office and have a separate set of clothes to drive back. But even then, you still want to do the procedures you're suggesting to get to that bathroom and have a bath or a shower. Is that right? Or just washing your hands is sufficient?
Well, I mean, ideally is to have a full shower if you can, right? Because I think I don't know how's the supply, for example, with hair nets, and gowns even, right? If you do not have access to those personal protective equipment, then for example your hair may be contaminated, and without a full shower, I think it might be difficult to get rid of the virus, and trying to and then I don't know if you do, but I have small kids at home, right? They have they don't have no respect of which area they're touching, right? So they can touch your hair, they can touch your face. So I think in my opinion, a full body shower would be would be ideal. Yeah.
Okay. Yeah. Okay. Well, that's really good. And yeah, I think we've covered a lot of great information. It's a dynamic time at the moment, and things are always changing. And I think the take-home message that we've gone over is change your clothes between patients, whatever, if it's a surgical scrub, a hairnet, and masks, surgical masks, they're changed. And I assume never reuse your gloves. They're off. And in summary, does that make sense from your perspective? Anything that you think we're perhaps missing as dentists?
Well, I think also, as dentists and doctors, we have such strong work ethics, right? And sometimes they show up to work even if they're sick. So I think right now is not the time to do that. And definitely we don't want to become like Italy when the entire healthcare system is overwhelmed and we're seeing thousands of deaths, right? That's not where Canada should go to. That's not the right path.
Yeah, and how about dentists getting together and having, you alluded to this earlier, a few dental offices as the emergency offices, and then we can pool our resources. You have less dentists exposed to it, less staff exposed to it, and you have one area where we can centralize all our resources. And then, like you said, almost like shift work. One dental office has it for 2-3 weeks or whatever, a week, and then another office in a local area has it. And we kind of pool our resources rather than having 8 dentists treat maybe 3 patients a day. You have one office who treats all those patients in 1 week.
I think that system, I strongly suggest if the dentists, they can organize in this approach. And what I'm hearing, the way that it works the best is to have one person to be working for 1 week and then taking 2 weeks off and then 1 week on again. And the rationale for that is after you work for 1 week, then that 2 weeks would be your isolation period. So if there's any symptoms that you happen to notice in those 2 weeks, then you'll realize and then not going back to work the week after. Yeah.
Right. And this could go on for an extended period of time. So one of the other debates with dentists was, should we do a procedure to get the patient out of pain and then maybe have a temporary filling? And my thought is maybe if we're comfortable, take the procedure to its finish and have a permanent filling. So potentially that patient can go away for 6 months or a year or longer, rather than have a procedure where it's like, okay, well, we temporized it. We want you back in a month or 3 months. Oh, we don't know what the situation is. It's better if we can close the door and basically finish that tooth and have it done. Then that's perhaps better. If all other things being equal, one-stop shop, less time in the dental chair is less risk.
Well, I think it depends on how equipped you are in terms of your personal protective equipment, right? Yeah. So if you have no access to any 95s at all, and you're just functioning with bare minimum with the personal protective equipment, then I think doing the temporizing measures may not be a bad idea.
Right.
Because once the epidemic hopefully become less or actually become more controlled, then the N95 mask will be in less scarce supply, and hopefully by that time you can access to them, rather than right now everybody is trying to stock up on the N95 mask and you try to get any of it. It's very difficult right now. Yeah.
So,
and I think some of the hopes of the public health officials or the epidemiologists is if we can flatten the epidemic curve until at least to the summer, where a transmission of coronaviruses are usually less permanent, less aggressive, then at that time then we might have a chance to be more prepared in terms of personal protective equipment or getting vaccines or and looking at clinical trials for therapeutics. So I think the idea is if we can buy more time and slow down the transmission at this current stage, then we will sort of take that as a win for now.
Yeah. So if you don't have ideal situations like an N95 mask, the less time in the chair is better. to temporize it, and if it's 3 months or a month, that's better than perhaps having a little bit longer time in the chair. Um, I believe that. I mean, it's a balancing act, but it's okay. I think that's quite helpful, because from what you're saying is if we can buy them a month, that's better than the patient being in the chair an hour longer, because it's just an hour longer in the dental office, and it's more exposure, more chance for aerosols, more this, more that.
Right. Yeah, and also I think it's also you have to think about going back to the original question you have for how to protect yourself and
Yes.
family. I think that's the key here. I mean, of course you want to treat the patient as much as you can, but also think about the procedure you're doing right now versus 3 months later, for example, which one gives you more risk, and whether or not at this moment you are the risk that you're exposing yourself, whether it is necessary or not. I think, and that definitely comes into your judgment there, right?
Yeah, time is a factor, and so if we can minimize our time and perhaps them come back at a different time when things are a little calmed down and perhaps a little bit better controlled. Okay, well that was fantastic. I think we covered a lot of great ground there, and honestly, a lot of us are panicking. So the information you shared with us, I think a lot of people are going to grasp. I know I am, and review a lot. On this PFX site, it'll probably be up in 24 hours. We're going to encourage dentists to ask us questions, and so we may send you some email, or maybe in a week or so, depending on how things change. Would it be okay to chat with you again?
Oh yeah, of course. Yeah.
Okay. Okay. Well, it's been, I can't thank you enough. It's been absolutely fantastic. And it's been great.
As well.
Yeah.
Yeah.
And we'll keep in touch, and thank you for helping us stay safe.
Great. Have a nice evening. Stay
Yes,
well.
all the best to you. Don't let those boys touch you till you get to the shower.
Okay.
So
Nice
I'm
meeting
just
you.
going to hit stop right now.
Okay, great.